Zenamavir Summary Fact Sheet for Patients and Parents. You have been given Zanamivir because you may have been exposed to the novel influenza or novel flu. As you may already be aware, a public health emergency has been declared in the U.S. due to a current outbreak of a novel influenza virus. You can decide whether to take this drug. Taking Zenamavir may help you or your child recover more quickly if you have novel flu, or may help keep you or your child from getting sick from novel flu. If you are taking Zenamavir as directed and you begin to feel sick, get medical care right away. What is novel flu? Novel flu is an otherwise not previously seen type of flu virus. Since novel flu viruses have not been seen previously, the virus may be more potent or less potent than seasonal flu viruses, but will most likely be spread the same way. What is Zanamavir? Relenza, or Zenamavir, is a medicine that is approved by the U.S. Food and Drug Administration, or FDA, to treat and prevent influenza. The FDA-approved package insert on Zenamavir can be found on www.fda.gov/CDER via drugs@FDA. Who should not take Zenamavir? Do not take Zenamavir if you have ever had a severe allergic reaction to Zenamavir or lactose. Zenamavir is not recommended for people with chronic lung disease such as asthma or COPD. Zenamavir should only be used for treatment of persons aged 7 years and older, and for prevention in persons aged 5 years and older. It should not be used for prevention of flu in nursing home patients. What is the dose of Zenamavir? For treatment, 10 milligrams or 2 inhalations twice daily for 5 days. For prevention in household setting, 10 milligrams or 2 inhalations once daily for 10 days. For prevention during community outbreaks, 10 milligrams or 2 inhalations once daily for 28 days. The dose should be given at approximately the same time each day. How should Zenamavir be taken? Zenamavir is packaged in a medicine disc called a rotadisc and is inhaled by mouth using a delivery device called a dischaler. Each rotadisc contains 4 blisters. Each blister contains 5 milligrams of active drug and 20 milligrams of lactose powder, which contains milk proteins. Each packaged box of Zenamavir contains 5 rotadiscs for a total of 10 doses and a discaler inhalation device. Read the patient instructions for use in the package and refer to your healthcare provider for instructions on how to use the discaler. Zenamavir should be given to children only under adult supervision and instruction. What are the possible severe side effects from Zenamavir? People should be aware of the risk of increased difficulty breathing, especially among people with a history of underlying breathing problems. If patients have increased difficulty breathing, they should stop Relenza and get medical attention right away. People with the flu, particularly children and adolescents, may be at an increased risk of seizures, confusion, or abnormal behavior early in their illness. These events may occur after beginning Zenamavir or may occur when flu is not treated. These events are uncommon, but may result in accidental injury to the patient. Therefore, patients should be observed for signs of unusual behavior, and a healthcare professional should be contacted immediately if the patient shows any signs of unusual behavior. How do I report side effects with Zenamavir? Call your healthcare provider if your child experiences side effects that bother you or that do not go away. Report side effects to FDA MedWatch at www.fda.gov/medwatch or call 1-800-FDA-1088. Certain aspects of this emergency use are not part of the approved drug applications. However, the FDA Commissioner has authorized the emergency use of Zenamavir. Additional information can be found on www.cdc.gov.